What if I told you that right now, inside your arteries, a silent assassin is building roadblocks to your heart? Every 18 seconds, someone dies from cardiovascular disease. That's 18 million people per year. For decades, we've fought back with statins. Daily pills, expensive injections, brutal diet restrictions. They work, but they're imperfect. Side effects, daily commitment, and for millions, not enough. Then in November 2024, everything changed. Scientists announced a pill that doesn't just lower bad cholesterol, it obliterates it. 86% reduction. Numbers so extreme, cardiologists had to check the data twice. What awaits us at the intersection of curiosity and wonder? I'm Lucas, and this is Mind and Marvel. To understand why this matters, we need to talk about cholesterol. The molecule most people fear but don't understand. Cholesterol isn't evil, it's essential. Your body makes it, your brain needs it, your cells are built from it. Without cholesterol, you die. Your neurons can't function, your hormones can't form. But there's a problem. Not all cholesterol travels the same way. HDL cholesterol, the hero, it carries excess cholesterol away from arteries, back to your liver. Think of HDL as garbage trucks, collecting waste from neighborhoods, keeping streets clean. LDL cholesterol, the villain. It delivers cholesterol throughout your body, but when there's too much, it infiltrates your artery walls, gets stuck, oxidizes, and turns toxic. Your immune system notices and sends white blood cells to clean up, but they gorge on oxidized LDL and die. Their remains accumulate, forming hard, calcified plaque that slowly narrows your arteries. Imagine busy highway suddenly shrinking from 3 lanes to 1 at peak traffic. Congestion builds and everything grinds to a halt. Your heart struggles to get blood. Chest pain. Angina. The warning signs. Then one day that plaque ruptures. A blood clot forms in seconds. Total blockage. Heart attack. Brain. Stroke. 800,000 Americans every year. Cardiovascular disease kills more people than all cancers combined. For 40 years, statins have been our primary weapon. They work by blocking an enzyme called HMG-CoA reductase. Your liver produces less cholesterol. LDL drops 30 to 50%, but side effects plague many. Muscle pain, liver damage. Some patients can't tolerate them. Then came PCSK9 inhibitors, injections, twice monthly, drop LDL another 60%, but they cost $5,000 to $14,000 per year. Insurance often denies coverage. Most patients can't afford it, which leaves millions at risk, unprotected, waiting for the roadblock to become fatal. Until now. Meet muvalaplin, the cholesterol assassin. This isn't another statin. It doesn't block cholesterol production. It targets something entirely different. The assembly line where LDL particles are built. Specifically, it targets LPA, lipoprotein a, the most dangerous cholesterol particle you've never heard of. LPA is LDL with a sticky protein attached. Like LDL wearing Velcro, it sticks to artery walls with terrifying efficiency, builds plaque faster, resists removal better. Here's the cruel part. Their levels are genetically determined. You can't diet them away. You can't exercise them down. 60 million Americans have dangerously high LPA. Most don't know it. And statins, they barely touch it. Sometimes they make it worse. Enter muvalaplin, a small molecule with surgical precision. Here's how it works. In your liver, 2 proteins need to connect to form LPA, a polypoprotein B and a polypoprotein A. When they bind, LPA forms. Think of them as puzzle pieces. When they snap together, the dangerous particle exists. Muvalaplin wedges between them, blocks the connection. The puzzle pieces can't fit. No connection means no LPA. The assembly line shuts down. Phase 2, clinical trials enrolled 132 patients, all with dangerously high LPA. They received various doses, 10 milligrams, 100 milligrams, 500 milligrams, daily, for 3 months. Then came the blood tests. At the highest dose, 86% reduction in LPA. Statins, minimal effect. PCSK9 inhibitors, 25 to 30%. Muvalaplin, 86%. Numbers so extreme, the research team ran the tests 3 times, but it gets better. Total LDL cholesterol also dropped, up to 24%, because LPA is a type of LDL, Remove it, and overall LDL plummets. Side effects? Remarkably minimal. No muscle pain, no liver toxicity, mostly mild gastrointestinal issues. And it's a pill, not an injection. Once daily. Simple. To understand why this matters so much, we need to talk about the genetic lottery nobody wants to win. Your LPA gene determines your LPA levels. Some variants produce almost none. Others, catastrophic amounts. It's inherited. If your parents have high LPA, you probably do too. 1 in 5 people have elevated levels. That's 20% of the population. High LPA explains the inexplicable. The marathon runner who has a heart attack at 35. The vegan with perfect habits who needs bypass surgery at 40. High LPA doubles your risk of heart attack, triples your risk of stroke, quadruples your risk of aortic stenosis. And until now, doctors were helpless. They'd test, confirm high LPA, then shrug. Niacin barely worked. Apheresis, blood filtering, is invasive, expensive, temporary. Most patients were told to manage other risk factors and hope for the best. Here's the evolutionary twist. LPA might have been beneficial once. It helps blood clot. In a world of infections, injuries, and wounds, that's advantageous. But in modern times, we don't have daily wounds. We live to 80. LPA just builds arterial roadblocks. Evolution didn't select against it because it typically kills after reproductive age. Your genes don't care if you die at 60. Muvalaplin is our override. Evolution's mistake, corrected by chemistry. But here's the problem. Most people don't know their LPA levels. Standard cholesterol panels don't measure it. You have to specifically request the test. It's a simple blood test. But doctors often don't order it because, until now, we couldn't treat it. That's about to change. Muvalaplin just completed phase 2 trials. Phase 3 is next. Thousands of patients, multiple years, tracking actual cardiovascular events, not just cholesterol numbers. The question, does lowering LPA prevent heart attacks and strokes? The mechanism suggests yes. Less plaque, clearer arteries, better blood flow. But medicine demands proof. That takes time. If trials succeed, FDA approval could come by 2028 to 2030. The impact? Potentially millions of lives saved annually. Combined with statins, LDL could drop to near zero levels. We could make heart disease rare, not the leading killer, but a preventable condition. But there's a catch. Will it be affordable? PCSK9 inhibitors work brilliantly, but cost renders them inaccessible to most. Pricing will determine whether this saves millions or just thousands. Eventually, generics will arrive. Patents expire. Prices drop. And this matters globally. Cardiovascular disease kills everywhere. Equitable access isn't just good ethics, it's good public health. The fact it's a pill helps. Pills are easier to manufacture, distribute, and administer than injections. The future, routine LPA screening. Identify high-risk patients young, treat before damage accumulates. Prevention, not reaction. That's the paradigm shift. For the first time in human history, we might eliminate the leading cause of death. We eradicated smallpox, nearly eliminated polio, turned HIV from death sentence to manageable condition. Cardiovascular disease is next, and muvalaplin might be the weapon we've been waiting for. A small molecule, blocking a single connection, preventing a dangerous particle from forming. This is precision medicine at its finest, not carpet bombing, surgical strikes. Which leaves us with a profound question. If we eliminate heart disease, cancer, and neurodegenerative diseases, how long can humans live? What's the biological ceiling? Are we slowly engineering our way toward practical immortality, one disease at a time, or will eliminating one cause of death just reveal the next? Does biology always find a way to reclaim us? And perhaps more importantly, should we focus on living longer or living better? Is the goal to add years to life or life to years? If this breakthrough in cardiovascular medicine amazed you, hit that like button. Science this important deserves amplification. Subscribe to Mind and Marvel for more stories where cutting-edge medicine meets human survival and the future of health. Drop a comment. Do you know your LPA level? Should genetic testing and preventive treatment become routine? Where do you think medicine goes after we conquer heart disease? This is Mind and Marvel, where science, survival, and the superhuman collide. Until next time, get your cholesterol checked, all of it, because knowledge might just save your life.